My name is Dr. Christianson. I'm an alumni from Southwest College of Naturopathic Medicine. I was lucky enough to be in the very first class. That was a great experience. My background, I had planned on attending medical school pretty much all along. I had known that I wanted to be a doctor of some sorts. I had also known that nutrition was a huge factor in health. I had a lot of health issues as a child. Nutrition had a huge impact upon those. And unfortunately, it was all things I had to figure out on my own. I was aware that doctors weren't really educated in this. And my plan was to pursue conventional medical training and then apply more into things that I had learned and more things I would learn in nutrition to a practice. I wasn't aware of naturopathic training at that time, but the closer I got to the goal, the more I learned that conventional doctors had very rigid standards of practice they had to adhere to. So even if they had knowledge of nutrition and good intentions, they couldn't always apply that. And I had kind of made that observation by some mentor doctors, come to that conclusion, and been somewhat disillusioned about my path at the same time I heard about the naturopathic profession. And that was also when Southwest College was just in its inception phase. It was starting to form. So it all fell into place very well, and it was a wonderful experience. I was very pleased with my education at Southwest College. So in naturopathic medical school, we were exposed to a big variety of modalities and a lot of different opinions, which was wonderful. Many were conventional, many were alternative. At the time, the concept of integrative was very early, and it was just forming. There was just a few people that were really trying to tie together some of the best of both the conventional and the alternative model. This was happening quite a bit in terms of understanding and treating thyroid disease. There was work from Dr. Broda Barnes that was still creating quite a bit of buzz and excitement. Dennis Wilson had talked about some concepts that were also affecting a lot of alternative practitioners. And at this time, the conventional model was quite a ways behind even where it was now. So there was these huge, very, very different ideas and understandings about how we diagnose thyroid disease, how we go about treating it in terms of criteria, whether blood tests are valid, what ranges do we use, what role does body temperature play in this, and then in terms of treatment, do we use synthetic medicines, do we use these desiccated tablets, what dosage ranges, and they were just completely different ideas. I saw a lot of merits to both sides of those. In my clinical training and also in my early years in practice, I saw that many people that would not have undergone treatment based upon the conventional model did benefit from treatment. But I did see shortcomings from the purely alternative model as well. So what I had been doing myself is trying to sort those two out and really tie those worlds together in some way. And that's kind of what my book was an extension of. I had been writing for quite some time along these ideas about what were the best concepts from the conventional side and the alternative side, and what were the shortcomings of each, and putting together some evidence for that. And that all became this book that I'm now discussing and talking about. Some of the key points that I went through, one of the big ones was diagnosis. The conventional model diagnoses thyroid disease right now exclusively based upon blood tests. If there's not a significant elevation of a TSH and a significant suppression of the free hormones, the T4 or T3 levels, one can't really claim that someone's hypothyroid by the conventional standards. And this leaves out many people that can have very significant symptoms. They can be quite a ways into an autoimmune disease process, but they would not undergo treatment by this model. Now we contrast with the alternative model, which is mostly an extension again of Dr. Broda Barnes. The alternative model is from his work, and he practiced over many, many decades, during the time of which there were attempts to get good ways to test thyroid function by simple laboratory methods, so many of which didn't pan out. He saw a lot of tests introduced, tried, and then disbanded as they were found to be quite inaccurate. Things such as total T4, protein-bound iodine, metabolic rate assessments. One of the earliest things that was used as a diagnostic criteria was basal body temperature. What's the axillary temperature in the morning of the patient? And the relevance was that the thyroid gland speeds up the metabolic rate, so there's a loose correlation between thyroid function and basal body temperature. When it's suppressed below a certain point, there's a suspicion of being hypothyroid. So Broda Barnes saw all these different laboratory tests come and go, and he saw their shortcomings, and he was left quite jaded or disillusioned about the value of laboratory testing. He realized that symptoms were important to diagnosis, and he had seen that many tests weren't much better than the old basal body temperature that he used in his early practice. So where he was coming from was a stance of diagnosing purely based upon symptoms and upon basal body temperature. And the plus about that was many people that had earlier stages of disease that wouldn't be diagnosed by the conventional guidelines could still receive a diagnosis and receive a treatment. Now, he also used those same criteria to titrate dosage, determine what was the best dosing for a patient. He would basically suggest that when they had achieved optimal control of symptoms and they didn't have an excessively elevated temperature, they were then at good control. And that's contrasted with the conventional model, which based that completely upon the blood markers. Now, the shortcoming of this idea is that a lot of people that really don't have thyroid issues or have symptoms from other causes still could fall into those diagnostic criteria. So we end up getting too large of a net. The conventional model was too small of a net. We missed quite a bit. But the pure alternative one was too broad, and too many would be diagnosed. And then also many can be overtreated. If you keep on raising doses until some point of temperature change or symptom control, you can have people on dangerously high doses. So there are shortcomings there. So what I've really talked about in the book is how to understand when to apply the alternative model. When is someone who is not inside the narrow conventional standards, when are they good candidates for thyroid treatment? How can they benefit from that? What types are most effective for them? And when is the end point of treatment? When are they at the point to where they would not benefit by further dose escalation or further treatment for thyroid disease? And I had a blast doing this book as an idiot's guide as well, because I got to be much more conversational, much more engaging. I didn't have to be dry and clinical. I got to really freely speak, but also give easy examples, make it understandable for people. And it was also fun, this particular topic. It acts as a very good kind of hologram of where we're moving towards with naturopathic medicine in general. There's many alternative ideas, some of which are very good ideas, very evidence-based, but they've not really been utilized. And there's many alternative ideas that probably should go by the wayside. And what we're trying to do is really tie together the best of the conventional model with the best of the alternative model. Kind of an unfortunate situation, but where things have gone with our mainstream medicine now is that things are very based upon one drug, one long-term treatment. That's where most research focuses on. You really need to have a synthetic substance that a large company can hold a patent on, and they generally want a condition that's already known to respond at least somewhat effectively to drug treatment, and generally longer term to drug treatment. So everyone wants the next Lipitor, the next pill for reflux disease, the next common thing that people will take long term. There's a strong disincentive towards using things that are already found in the natural world. So in the case of thyroid disease, I talked about the differences of synthetic treatment versus desiccated natural thyroid. Things that are already found in the living world can't really be patented, so there's less incentive towards large companies to do the endpoint research and do the establishment of treatment protocols for them, because the approval process costs at least $300 million or more, and if they can't patent a product, any of their competitors could have the same product brought to market and not have to go through those approval processes. And this is unfortunately a shortcoming for a great deal of lifestyle interventions, nutritional therapies, botanical medicines, natural hormones. There's really not a lot of incentive for big pharma to do those things. There's more incentive towards doing synthetic meds that are taken long term. And that model as it stands has brought us some very good things, but unfortunately many very effective therapies have been gone by the wayside or given too little attention. So as far as useful steps, people themselves need to be aware that if they're having ongoing symptoms, if they're not feeling well in some way, that there really are reasons for that. Too often conventional medicine just wants to take symptoms and put that into a diagnostic category and then find the most appropriate drug treatment. And many cases don't pigeonhole quite that well. That's this whole idea of functional medicine. So by and large, don't assume that your symptoms that you have to last and have to persist. The beauty about naturopathic medicine and these more integrative approaches is that we do understand that model, and there's very good things that model will catch that do need drug treatment. But we also understand many other aspects of health that don't fall in those categories. And if you have someone that has symptoms that don't respond to a common drug or don't fall into a simple diagnostic category, there still can be hope and there still can be help. So don't give up on things. Keep on searching, and things can improve. I practice in Scottsdale, Arizona at Integrative Healthcare. We're on 92nd Street in Raintree, just off the 101. We've been here for roughly 16 years now, coming up on that. And our website is integrativehealthcare.com. We also have Drs. Ann Levick and Dr. Phil Wozni in our practice.